Did Jennifer Lawrence get eyelid surgery? This question has exploded online since photos emerged from Paris Fashion Week in September 2025.
Jennifer Lawrence plastic surgeon needs to go to jail right now. Her face at Paris Fashion Week is completely unrecognizable.
So let's take a look. Her eyes do look different. They do look a little bit more open and more defined. So what is the truth behind this? As an eyelid plastic surgeon specializing in cosmetic surgery, I'm going to break all of this down. And my answer might actually surprise you, especially if you're one of those folks that thinks that everyone in Hollywood has had plastic surgery. I'm just going to be taking a look from an expert's perspective at some differences that you might see, and that you might see from lighting, makeup, angulation of photo, what facial expressions you might be making in the photos. It's not always explained by surgery. Ultimately, Jennifer Lawrence herself has addressed these rumors, and we'll get to some of her explanations as well. Okay, so first let's establish a baseline. If we go back and look at photos of Jennifer Lawrence from her earlier career, like when she was in the Hunger Games, we'll take a look at her anatomy. So let's look at her eyes. What you actually will notice from this photo is that she naturally has some hooding of the upper eyelids. And a lot of people have that genetically from a young age. It doesn't necessarily mean that is an excessive amount of skin. And a lot of people have had that from a young age. It's just genetics more than anything else. When we say hooded eyes, what does that mean? So basically, if we look at the skin from the eyebrow down to the eyelashes, does it crease into a fold and kind of overhang and sit near the eyelashes? Mine naturally doesn't, but a lot of people have that fold there, and the fold can sometimes creep lower and lower and touch lashes as we get older. There's a trend on the internet now called hunter eyes, and in fact, she has hunter eyes, which is no surprise because she's Katniss. So when you have hooded eyes, the distance from your eyelashes to that fold is super narrow, and so sometimes my patients will complain they can't wear eyeliner or eye makeup anymore because they are not able to really define that area. Some people, like Jennifer Lawrence, have it from a young age naturally. Now let's talk about her brows. If you look at her brows, they tend to have more of a natural flat shape, and importantly, they have asymmetry, so keep that in mind as we look at future photos. This is her genetic starting point where her brows are kind of low, and it's a very natural and beautiful look. Not everybody's brows have to be high and arched. You have to kind of take that into consideration as you look at people individually. The most important thing is that even at a young age, she had a symmetry between her eyelid creases and her brows. I want you to remember that as we go forward and look at more recent photos. Okay, so now let's jump to these photos from Paris Fashion Week that prompted all this speculation all over again. Looking at these images, I think you can see there are some differences. The question is, are these from plastic surgery or something else? Her eyes do appear more open, and that space that we talked about between the eyelashes and the fold appears bigger. Some would say that that's from a blepharoplasty, but I really want you to think carefully about how other factors can also influence this. So what's an upper blepharoplasty? An upper blepharoplasty is where a surgeon like myself removes a conservative amount of skin from the upper eyelid area, and conservative is the key thing, because if you don't go to a surgeon that is safe about how much skin they remove, that's how you will get botched with this kind of surgery. The goal with this procedure is to reduce some of that heaviness and hooding to give a little bit more of a lighter, more awake and alert appearance. When done well, it's hard to tell when somebody's had this procedure. You just kind of have a sense that they look better and younger, and you can't say exactly why. That's the result that I try to achieve for every one of my patients. So this is where the analysis gets a little bit complex, because on the one hand, you can look at these photos from 2025 and say, wow, she had a really nicely done, conservative, natural looking upper blepharoplasty. But here's why I'm not sure. First of all, she's come out and said that she hasn't had eyelid surgery. She had an interview with Kylie Jenner in some magazine where she basically said that it was her makeup artist and that he's basically a plastic surgeon, what he can do with eye makeup. And certainly makeup can make a difference in terms of how your eyes look and how defined that crease appears. Some people wear eyelid tape, which you can cover up with makeup to more clearly define the crease, to lift that fold, and you really can't tell. I've even had patients walk into my office with eyelid tape on, and it wasn't until I examined them from like 6 inches from their face that I was able to see the tape there. The second thing is that makeup can accentuate how the outer canthal area at the corner of the eyelid can look. And so you don't always necessarily know. The third thing to know is that depending on the facial expression that you're making when you have a photo taken, it can affect how that hooded upper eyelid skin sits. So for example, if I have my forehead relaxed and I'm not tilting my head up, the eyelids can look a little bit heavier and overhanging skin can hang more down. However, if I'm making a facial expression like this, the outer eyebrows go up and it pulls that skin away, so it might make it look like you've had an upper blepharoplasty when nothing has actually been done. So another thing to consider is the natural aging process. So Jennifer Lawrence has noted herself that over time, since she was younger, she's lost some of the baby fat in her face. And a lot of us do. Basically, as we get older, some of the fat compartments where naturally fat is placed around the face can get a little bit deflated or devolumized and look more hollow and sort of by gravitational descent go down in the face a little bit lower. This can especially affect the lower eyelid area and cheek area, but it can even affect the upper eyelid area. Sometimes people as they age just naturally get more hollow up there, and it's not because of weight loss or any other factors, it's just their genetics. So what's my professional opinion on the changes that we're seeing in these photos with Jennifer Lawrence's eyes? After reviewing these photos and considering all these different factors, I do not think that she has had any kind of eyelid surgery, and I'll tell you why. She has the exact same asymmetry that she did at a younger age that we looked at. It's pretty stark, so look at this carefully. You can see more skin from her eyelashes to her fold on her left eye as compared to her right eye in the photos from the Hunger Games, just the same as you can see that asymmetry in these photos from Paris Fashion Week in 2025. In addition, the asymmetry of her brows is consistent. You can see that in the Hunger Games photo, her left brow is a little bit higher, her right brow is a little bit flatter. So most of us who do plastic surgery around the eyes, we are trying to correct asymmetry, make the eyes more symmetric. We're not trying to preserve asymmetry. So while it's possible that her surgeon very delicately created the same asymmetry that she has between the eyes, I don't think that's very likely. That's very hard to do, to perform a surgery where you get consistent asymmetry in photos taken more than 10 years apart between the eyelids. Now, if she had surgery, the changes are very subtle, and that's partly why this question is so compelling. But from a surgeon's perspective, I see no definitive signs of a procedure around the eyes. Now, let's talk a little bit about the midface area. That's a different question. The midface area is the area below the lower eyelids in the cheek area here, and sometimes we want to put more volume in that area, like putting more stuffing into a pillow to make it harder to compress. That's a very common thing in Hollywood and really anywhere, and it can be done surgically with something like fat transfer, which is my preference because it gives a more natural glow to the cheeks, or non-surgically in a spa office or something like that with something called fillers, which in my opinion can result in a more unnatural appearance, but is a very popular cosmetic procedure. So the other thing that could have happened here is something called a midface lift. That's where we go and we take this area and lift it up to about here using an incision from behind the hairline. That would be kind of like pulling the pillow itself as opposed to filling it with more stuffing. We may never find out if she had surgery, but I would agree that her eyes do look a little bit different in these two photos 10 years apart. However, the consistency of the asymmetry makes me think that in my professional opinion, she has not had eyelid surgery. It is possible that she had a brow lift, which would lift both sides from here and therefore pull up the eyelids a little bit, but since you didn't put an incision on the eyelids, you can retain some of the asymmetry between the two eyes. So if you like these types of facial analyses, please subscribe to our channel, and if you have other celebrities you want us to take a look at, please let me know in the comments. Hope you enjoyed this video.